you can do that. Good morning, everybody, and welcome to this Safer Learning Environment Charter webinar. My name is Barbara Foggo, and I'm the Strategic Lead for the Enabling Effective Learning Environments programme. So myself and my team are responsible for placement provision for nursing, midwifery, HP and healthcare science students, but also looking at the quality of placements, which is where the Safer Learning Environment Charter comes in. So we've extended this to all learners and extended this webinar out. So we hope that you really get some good knowledge about how we can begin to deliver the Safer Learning Environment Charter to our students so that they have a really good placement with us. So Natalie and Emma, over to you so we can begin this webinar. Thank you very much.
Thank you. If you just want to start sharing, Natalie. So I'll introduce myself. So my name's Emma Clayton. I'm a clinical lead for the EELE team, and I predominantly cover the Tees Valley, the south of the ICS. And my background is adult nursing. I'll hand over to Natalie.
Yeah, hello everybody and welcome. So my name is Natalie Godley and I'm also clinical lead for the Enabling Effective Learning Environments team covering North Cumbria. And now I'll share because I do lose you once I've shared my screen.
Brilliant. So thanks for joining us today. So what we're hoping to give yourselves is a brief overview of the Safe Learning Environment Charter, often heard as SLEC. So how it was developed and how to access the resources that make up the 10 themes or priorities of the SLEC and what it means for yourselves out with your organisations and how these can be implemented and embedded and charted into the clinical learning environment. So just a few housekeeping rules. So I would really appreciate it if we're able to keep your microphones on mute. There will be an opportunity at the end of the presentation where you can ask questions, but please feel free through the presentation to pop anything in the chat and myself and Natalie will try and respond. So if we can just do the next slide, Natalie. Right, so this is just a bit of an introduction to SLEC. So in context, Health Education England, as it was in response to the Midwifery Kirkup report in 2015 and the essential actions for trusts from the Recordin report in 2022, developed a project. So the project itself was a 3-phase project. So the first phase was what does good look like? And this formed part of the project. It was an opportunity for the quality teams to explore the learning environment and experiences of the learners and newly qualified midwives across England. So midwifery learners from the Northwest region made up the bulk of those, and they set up various focus groups. So colleagues in the Southwest region also took part and facilitated a control group for the project. So they looked across all other professions, including HP, nursing, doctors and dentists in training. So the other phase 2, was an assessment of learners in practice and exploring models of supervision, which are ongoing. So the data from the focus groups were analysed by a HASC Health and Society Knowledge Exchange group, who performed a thematic review in February 2023. So through a data analysis, it was found that the results for student midwives were not quite unique to the other professions and were similar across multi-professional groups. So from this emerged 10 themes from the thematic review, and it became the 10 recommendations. So there were a further 25 workshop events held, attracting over 400 stakeholders regionally and nationally, who collaborated and developed the 10 priorities of SLEC, and that's what we see today. Natalie, do you want to go to the next slide?
I can, yeah, thank you, Emma. So as we've considered across the North East and North Cumbria implementing SLEC, we have been supported by some of our strategic colleagues. So you can see there's David Pardew in his role of Chief Nurse and HP and People Officer for the ICB. who has said that implementing the Safer Learning Environment Charter will allow staff and students to thrive and to support them to deliver improved quality of care for people in the North East and North Cumbria. And then we have underneath David, we've got Janet Folland on behalf of the AHP faculty, who says that the principles on which the Safe Learning Environment Charter are based supports the development of a positive culture, mutual respect and shared learning. And the implementation of the Charter across the North East and North Cumbria will benefit learners and educators alike and will promote personalised and quality care. And as an AHP community, we applaud the development and support its adoption across the system, which is really, really positive and gratefully received from both of those. Sorry, Emma, it's a bit slow when transitioning over at the moment. Okay, so why does SLEC matter to your organisation? So the main aims of the SLEC project were to advance the high quality learning environments and to strengthen the workforce. And we know that if we can improve the environment for the learners, number one, we hope that they encourage them to stay within their professions and strengthen the workforce, but two, that we enhance the environment for our registered members of staff also. And we also know that if our learners are in an environment where they feel safe and supported, that it will improve patient safety too. So NHSE envisage the SLEC to be implemented across all organisations by September 2025. Next slide, just bear with me. Emma.
Yeah. So the SLEC resources, so when the developers were considering the SLEC, they wanted a practical resource, minimum cost, and one that would be used in clinical areas. So on the NHS Learning Hub, you can access a catalogue of resources which are linked to the Charter. Within the resources is a full HASC document available to look at the processes and development and themes at a granular detail of what learners have told us as what good looks like in the environment. So on the catalogue on the Learning Hub, it's available to anyone with a login. Athens and e-learning for health log, it can be used. It has over 100 resources, including documents underpinning the SLEC and its design process. So the Charter itself, it's about 35 to 40 page document. And the resources, a solution-based toolkit, there's 10 themes that are fundamental in making up the Safe Learning Environment Charter and the 10 posters to support each theme. So what I will say is we have actually got these. So we've got our own future NHS site, which, you know, if you wanted to join, by all means, pop myself or Natalie an email and we can get you joined up to our own future NHS SLEC site, because we have actually, just to simplify it, we've actually popped it on there and we've popped it into different areas and simplified it a little bit, because some people have said that the toolkit itself, they can't always find what they're looking for, which we have fed back to the national team. So there's also implementation pack and a maturity matrix with descriptors and live assessment and a live assessment toolkit. So all of these are available also on our NHS future NHS site. So we're now going to look at the poster. So this is a SLEC poster, and this is what you'll possibly see around different trusts and different areas. So the poster highlights the 10 key priorities of SLEC that were identified from the focus group data. So the 10 priorities can be seen around the edge and threaded a strong golden thread that runs around them. You can see the 10 different themes, and then you've got your gold thread that runs through the Charter. So that runs through the Charter with the EDI and the patient safety, which are fundamental to patient care. And it really is the four-way partnership between the learners, the practice educators, education and placement providers. Natalie?
Thank you. Sorry, I jumped ahead there. So this is an example of the published posters that you can find on the NHS Learning Hub as well. And there is, like mentioned before, there is one poster per theme of the SLEC. And these have been put together gather and reflect the voice of the learner and the collaboration of the stakeholders in those focus groups. And it really does highlight some practical actions around each of the priority themes, and it identifies who is responsible for these in practice. And these are to be used in conjunction with the charter. So don't know, it's quite small in terms of text there, but you can see that it says together education and placement providers should, practice supervisors and assessors should, education providers should, placement providers and learners should. So there's real examples and about who kind of takes the lead on those elements. So also forgive the small text. Like I say, you can access this on the Learning Hub or from the NHS Futures site, and we would encourage you to actually go on and have a little look and see what those descriptors are of the maturity matrix. But they can all be found within the resource catalogue, and it's an interactive tool to support organisations to assess their maturity. There is an expectation that organisations do assess their maturity towards the Charter and that they use this as a quality improvement tool. So good practice within the region, we would see collaboration and open conversations between the HEIs, placement providers and the learners when self-assessing. And we need the opportunity to kind of positively scrutinise our learning environments and make sure that they're fit for purpose, they're safe, and that we can adapt them to suit our learners' needs. Okay. So this diagram here pinched with pride from our quality colleagues that developed the SLEC, but it really does summarise what we're looking to do across the North East and North Cumbria in terms of implementation of the Safer Learning Environment Charter. So we've touched on the availability of the resources, of the documents and legislation behind the development of the SLEC. And we recognise that the SLEC obviously aligns and supports the long-term workforce plan, our NHS people plan, educator workforce strategies, to name a few. And it also aligns to the NHS health and wellbeing framework when we're looking at developing a safe culture for our learning environments. We've talked about the work that's been done in the development stages of the SLEC to include the learner voice and stakeholder collaboration. And across the region and from our national teams, we are encouraged going forward to continue to have the learner voice and our stakeholders when we're doing our self-assessments and using the maturity matrix. And we do need to use those resources to come up with real practical solutions to support the 10 themes of the SLEC. The maturity matrix can be done at strategic level, departmental level, ward level, team level, to assess how we're meeting the priorities. And we may be meeting some of them really well at the moment, and we can also use it to identify some gaps which need to be addressed. Since its launch in October 23, the SLEC has become a catalyst and a driver for a national driver for quality, and as such it will be embedded within the organisation's SAR reporting, and there will be a clause within the 24-25 NHS education funding agreement around the implementation of the Charter. So organisations can use data from staff surveys, from student net surveys, placement evaluations as evidence to evidence delivery of the SLEC. And also it's good evidence for any quality visits or placement audits in the learning environment to support the work there. Implementation should be collaborative and joined up, and it's everybody's business to improve the quality of our learning environments. So Emma mentioned before around our future NHS site, but across the North East and North Cumbria, the EELE team have been facilitating a task and finish group, which I know most people on the call today do attend and are signed up to, but it's an open forum really that we can discuss some of the challenges and good practice that we're coming across whilst we're working in our organisations to deliver this SLEC. So I think really that's a bit of an overview, and I think if I stop sharing, it's really over to you, and if you've got any questions, then we'll try our best to facilitate those answers. Just stop sharing so I can see you.
Do you want to stop recording, Natalie?
Can do.
Anna?
Hello, sorry, Natalie